All right, we are live. This is Josh, Dream Body Clinic, and doing a live stream today just to kind of give you all more information about stem cell therapy. So, our website is www.dreambody.clinic. You can go to the website, it's got all the information about our stem cell therapies, our HGH flying by program. We now have a link to the Muse cells, which is www.dbcmusecells.com, and a lot of other information there. So Dream Body Clinic is a regenerative medicine clinic in Puerto Vallarta, Mexico. We've been around for about 13 years now. And we started out just focused on specialized medicine, things like human growth hormone, testosterone, modafinil. These are great medications that can be extremely tough, if not impossible, to get in places like where I'm from, which is the United States. I grew up in Seattle, and up there it can be tough to get those. And in most states, and even in Canada, in Europe, UK, we've had patients from all over the world. So it turns out it's illegal to seek medical treatment abroad and return home with 50 dose units of medication. So we created this program where you could fly down, meet with the doctors, do some blood work, make sure you're a good candidate, and then fly home with it. So that's what we started with. That's what we do. It's been working incredibly well for 13 years to help thousands of people to get medicines they couldn't. So I got real interested in growth hormone starting about 20 years ago. Unfortunately, my dad got Lou Gehrig's disease, and up in Seattle, they didn't give him many options. So he's a very smart man, had a big aerospace company. He started looking into how they treat other muscle wasting diseases, because that's the big problem with Lou Gehrig's, is that your muscles start deteriorating and you eventually suffocate. So he's desperate. He's looking for what he can do. And he comes up with HIV muscle wasting. If you have that, they will throw things like human growth hormone and testosterone at you like you're a bodybuilder. So he asks for those, and they tell him, no, we can't do that. That falls under the Anabolic Steroid Act. They're like, well, that's stupid. He's 50 and dying. He's not going to go be some pro bodybuilder or pro baseball player or something. But those are the rules. They wouldn't do it. It's unfortunate. So he couldn't get it, but it stuck with me that he could. I eventually ended up in Mexico about 17 years ago and learned that you can do this. My wife's sister is a doctor. Started working with her at first and started this flying by program. People started coming, and we've been doing it ever since. So that's how it got going. And then about 9 years ago, you'd hear rumors, things going on, that they were doing stem cells in Mexico. So we were interested. I'd heard lots about stem cells and their regenerative properties, healing joints, anti-aging, different things. So looked into it, eventually found a guy who had done his PhD in cellular biology. And I think he did it like 18, 19 years ago, and was doing stem cells out of Guadalajara. So we started working with him, but we saw pretty quick that the quality control just wasn't there. This is a big problem in Mexico. It's such amazing medicine, amazing doctors, but people tend to cut corners. They think if they have the lowest price and whatever it takes to get to that lowest price, somehow that's what's going to get people. They don't focus on the quality. So we had to solve that problem. And so we rented space with the University of Guadalajara's research division, and we were renting space there. We got our own biologists, started cultivating stem cells. So we've been doing that for a long time now. And since then, we've built our own hospital and a lab on site. So we have that now. So we've got our own MRI machine. We've got our own team of chemists and equipment for analyzing blood work, and a full lab for cultivating mesenchymal stem cells. So that's become our main business, is the mesenchymal stem cells. So I just wanted today kind of go through that, explain to people how it works, what we do, what we can treat, just kind of get in the nitty gritty of it and take some time here. So there will be kind of a longer video. So if you want to stay tuned, I'm going to go through everything, and that way you can really be informed about what stem cell therapy is, what it can treat, what it can't, and everything in between. So that's what we're going to go for. So let's start with mesenchymal stem cells and how they're procured, how we use them, what we do. So to obtain them, we work with a team of gynecologists that only work with first-time mothers. And with that, it's very important because we want young, healthy women for young, healthy tissue. The younger the woman, the less risk of complications or issues. So our donors have to be between the ages of 18 and 25. They have to be first-time mothers. They have to be married. We even ask them how many sexual partners. I mean, we get really into this. And we do lots of blood work to make sure that they're good, viable candidates, because a mesenchymal stem cell can't carry a virus. So you don't have to worry about that. But if the mother did have a retrovirus, there's a less than 5% chance of carryover. We don't want any risk with that because retroviruses are the worst kind. Think like HIV, you think hepatitis C. These sort of illnesses are typically retroviruses, so we need to screen for that. Luckily, they're very easy to screen for, so we test the women, then we test the umbilical cord tissue, then we test the cells, then we test the cultivated cells, so there's no risk of any carryover or anything. But younger women that are married, haven't had any, only had one sexual partner, they're at the lowest risk, as most of those diseases are sexually transmitted. So that's why these young, healthy, first-time mothers. So very stringent. Luckily, we only need a new umbilical cord every couple months, so we're not going through a lot of these, which is good because we get a lot of cells per umbilical cord and placenta. And so we take that. We have about, I think it's like 6 or 7 hours to get it from the birthing room to the lab. So we've got to get it straight there and then start processing. And in the processing, I think this is what I wanted to go over with first for people so they can understand the process, how this works, because there's a lot of bad info out there. Now, look, the quality control, I think, is the most important. And these are the steps we do. So first, we need good, healthy donors. Then we need to make sure that we've got a great lab to do this. In fact, we have the only ISO-rated lab in Mexico. ISO is the International Standards of Operation. So they've come in, they've tested the air quality in our lab to make sure it's to the right specifications. No other labs are doing this in Mexico. The only other ones I know of, I think there's one in Panama, there's one in the Cayman Islands, but that's about it. No one else is really going these extra steps to make sure that they've got the air purity you need. And you want that because though we can get the cells very pure with the equipment we have and everything, the air is where those things can be transferred. You can start picking up problems, and it has to be extremely sterile. You don't want any bacteria, endotoxins, anything like that. And a lot of these labs, the precautions they take are pretty disgusting. So we got to make sure we're above and beyond because, look, I'm American. I own and operate the clinic. I know what Americans think of Mexico, right? I grew up there. I know what people think. It's going to be some gross back alley kind of place, and it couldn't be further from the truth. We have to be above even U.S. standards because I know what people think, so that's what we do. We've got the best facility you could have. We've got all of the licenses here in Mexico that we can have. The problem there is the government doesn't really update that website, so you can't really verify there. So we're like, all right, well, let's go with ISO and verify there because then you can really see we went to the highest level of, critique to make sure everything's perfect, and they gave us the approval. So we've got that, GMP, everything to make sure you get the best cells possible. So let's go into process. So we take this big, it looks like a big piece of meat, the umbilical cord and placenta. We take it to the lab. We start dissecting it. You're putting into these cylinders, and you're putting in what's called collagenase, and then you're centrifuging it, spinning it super fast, and that separates the cells from the tissue. So now you have it works out around 70% mesenchymal stem cells, 30% other types of cells. So that's the kind of the first step. Now in the United States, that's as far as they can go. And that's what they use if you get umbilical cord cells in the United States. They're not pure and isolated. We're able to purify ours and fully isolate them, which is the big difference. So the next step is we then take that liquid and we need to spin it down even further. We got to make sure that we call the pellet. So we spin that down to where it's just this little white pellet left over in there, highly concentrated, full of cells. And then that is put into the flask. Now the flask is what it sounds like. It looks like a drinking flask, but it's plastic. And we put the pellet in there with the culturing medium. And the culturing medium is like the food for the cells. This is what's going to keep them alive and going while we put them in what are called the incubators. Incubators are, think like specialized ovens where we can control the temperature and CO2, the oxygen levels, everything in there, which is extremely important to make sure that you can have the best cells possible. They need very good living and growing conditions. So we got to provide that for them. So we put them in there and they start eating through this culturing medium. And then once they've eaten through that, we call that a passage. And the passage means, all right, they've gone through, they've eaten. Now we need to either take them out or we need to go another round. So that's a passage. So we go another round because you don't even get to pure isolated stem cells until you're about at the third passage. So we keep doing that process. Once you get to the third, and after that process, we have to do what's called an enzyme flush. Put in these different enzymes, that flushes out all of the other types of cells. And it takes about 3 passages to get rid of everything else to be pure isolated mesenchymal stem cells. So that's where we're at. The stem cells don't get flushed out because they adhere to the plastic. So every time you do that flush, they stick, the other cells don't, we get rid of them. So now that we've done that and gotten it through, we're able to take them out and administer them. So we've got a ton of incubators. We're making sure every day we've got new batches coming out. This way we can provide our patients fresh, never frozen cells, which is like the gold standard. You'll hear this from Panama. They call them golden cells. They do the same exact process. We just didn't coin that term. We'll call them platinum cells if you'd like, makes you feel better, but it's the same thing. So that's what we're able to do to make sure that you can get the best cells possible. This is plugged in here. And so that's the process for mesenchymal stem cells. Now you got to get into what do they do, what do they work for, what do they help? So we treat a lot of different things. I'd say probably the number one thing that we treat would be, knees, right? Everybody's knees go at some point. That's just like a given. Seems like it happens to everyone. Then the next thing that typically happens are lower backs. That's probably number 2. I'd put necks at maybe number 3, and then we're looking at autoimmune diseases and chronic degenerative issues. The most common chronic degenerative issues would be things like heart failure. See a lot of that. Mesenchymal stem cells do wonders at getting the ejection fraction back up to normal. So for patients that have had like a heart attack or just age or degenerations occurred, we're able to fix hearts. It's incredible. We've seen a lot of cirrhosis where from either drinking or different liver problems, actually, believe it or not, eating too much fast food is usually worse than even just alcohol abuse. And we can fix that. And after that, you're looking at like kidney failure. We're getting great results back on that. Actually, my best friend's dad back up in the Seattle area where I'm from, he was at 4th degree kidney failure. We've got him to 3rd degree, and we're hoping to take him further. Now, look, we always hope it's one and done for treatments, but sometimes it takes more than one, depending on the severity of the condition. So a lot of different things. We also help brain issues. We've got a whole protocol. We had a couple patients this morning, did what's called the intrathecal treatment, where we go into the spinal cord fluid, allows the cells to go to the brain and start healing there. So I mean, we can fix so many things. It almost sounds too good to be true. And that's where people, I think, they feel like, well, if this is that great, too good to be true, why don't they have it in the United States? And they kind of do, just not to the extent that we have. So in the United States, like I mentioned earlier, you can go to that, minimal manipulation is the rule there. So you can centrifuge them, get that 70-30% like ratio of MSCs to other cells. They can freeze those, send those to doctors and do it. They can also take it via liposuction or bone marrow aspirate from your hip and centrifuge that up and then use those cells. The problem is you just don't get enough cells and they're as old as you are. You want those young, healthy ones. So that gives umbilical cord and placenta the big advantage. The problem with the ones in the US, first, you're getting about 70-30% mix. They're also frozen, and if you don't thaw them properly, you're going to have minimum 50% die-off up to 100%. Actually, Regenexx, one of the largest stem cell providers in the United States, did studies on this, and that's what they found, was that if you didn't thaw them properly with these specialized ice baths, it looks like a little mini jacuzzi for the cells. You put the vial in there and it slowly thaws it, and that prevents the membrane from rupturing. So those are some of the big things that it does. Oh, some people are messaging in there. So yeah, I'm telling people how it works. We got Elliot from Seattle. Hey guys. So we're going through all those things, and yeah, you got to make sure you've got the right kind of cells, that you're doing it the right way, the highest possible level, right? So back to what we can treat. So let's start with knees. That was the first thing I ever treated. I had multiple meniscus tears, a partially torn ACL. So I did my knees. And in doing that, we did MRIs first, and you could see multiple meniscus tears, partially torn ACL. It was a lot worse than I thought. I mean, my knees had always hurt me. I'm pretty tall. I'm about 6'2", 245 pounds. And when you play every sport growing up, that wears on your knees. Being tall doesn't help. And my knees kind of started going out. So we did my knees, and it didn't take that long. It took about 2.5 months post-treatment. It didn't really feel like much was happening. I was kind of like, oh man, is this going to work? My whole business is riding on this. I did feel kind of good at first because of all the extra fluid. And then right at 2.5 months, it was like a light switch went off, just stopped hurting, never hurt again. In fact, we did my left knee first about a month before the right knee, and I was almost limping on the right one because I could feel the difference. So with that one, it was a bit more gradual, and I was seeing benefits sooner. So that's part of why I did the second one. So with the knees, we treat a lot of meniscus damage. If it's a complete tear, we can't fix it. If it's extreme tear, like I had a patient send me their MRI today, it was a really bad, what they call bucket handle tear. It was too far to where we could do it. And we're very honest with people. We'll tell you if it's something we can fix or not. Arthritis, that's the most common thing we treat, mainly in the knees, but you see it in the shoulders, elbows, wrists, different places too. The stem cells will get in there, and they'll get rid of scar tissue first. They'll guide the repair process. They'll get rid of the scar tissue, they'll guide that repair, then they'll guide the regeneration of that tissue. So that's how they work in a very simplified manner. And with the knees, they can get in there, and we put it, there's only 2 spots. Let's see if I can kind of show you here. You got, boom, right here is one spot, or here is the other. Those are the infiltration points. And if you feel your knee there, you feel it's a bit softer right there, and boom, can go in there or there, and you're going behind the kneecap. And from there, the stem cells will seek out inflammation and damage. So they don't need to be like pinpoint to the spot. We have the newest deep field ultrasounds, and they're amazing. But at the end of the day, you're looking at a bunch of squiggly lines, and you can see openings, but it's not like Star Trek. You're not seeing this whole 3D image of the inside of the knee. You have to know what you're looking at and what you're looking for. And even then, it's not like a crystal clear image, but it's useful. It does help. But the point is, you don't have to hit it pinpoint on. I mean, look, I just mentioned cartilage, ligaments, tendons, meniscus. You just have to get it. It's this big hollow chamber back there. We fill it up with the fluid. In fact, when you do it, it feels like almost like a little balloon filling up when you put the liquid in. And they start seeking out the different areas that are damaged, and they get to work. So with mesenchymal stem cells, it's around a 1% engraftment rate. And this is why we have to do such large amounts, like 50 million stem cells. You're like, whoa, that sounds like so much. But when you think maybe like 500,000 of those are really hitting the exact spot and really doing the majority of the work, you're like, okay, starting to understand why we have to get these bigger numbers and why treatments in the US can be so ineffective. When they take it from fat or bone marrow, you're looking like tens or hundreds of thousands of cells. So it's not even close to the same amount. Let me see here. So we got, was once intrathecal, life changer. Thanks, man. That's great. So that's the treatment where we go into the lower back, gets it to the brain, clear up brain fog. It can help with stroke recovery. It can help with traumatic brain injury. See a lot of that. We've had a lot of patients with like Xanax issues, get their head and more clear back from that. And we got Randy here. 40 million mu cells for ulcerative colitis. So mesenchymal stem cells have worked incredibly well for ulcerative colitis. This is a autoimmune disease that affects the intestines and causes major issues. it's not fun. I mean, sort of thing where it can be like constant diarrhea almost all the time, lots of pain. I mean, it's just the symptoms with that one are horrible. And we've helped a lot of people with that. But I'd say with ulcerative colitis, it's about 80% success rate. People do like our 300 million IV that goes through the system. And it's not just getting it to the intestines and the whole gut area. It's fixing the immune system. That's the first step, right? So I guess to answer that for you, Randy Perry 3774, I actually think mesenchymal stem cells are going to be better than mu cells, or at least you would want to do them in conjunction or first, because you can't do mu cells and mesenchymal stem cells together, and we'll get to that in a second. But we need to fix the root cause, and the root cause of any autoimmune disease like ulcerative colitis, MS, rheumatoid arthritis is going to be the immune system. It's not working right. It's attacking things it shouldn't be. So by doing the IV, our goal is to reprogram the immune system. The MSCs will send out these specialized cytokines that will interact with the immune system, hopefully reprogram it. So it's like hitting the factory reset button, start protecting instead of attacking. That's why it's so important we get these from young, healthy donors, from these tissue. It's only 9 months old. It hasn't had a long enough exposure to the immune system to start having all the problems and bad like error rate that you have as we get older. So it's like hitting the factory reset button to what it was supposed to do when you were a little kid. So we got to first fix that. Then once that's fixed, if you're still got too much damage from all the past like flare-ups and everything, with that, with MS, with say rheumatoid arthritis where the cartilage is worn out, if the MSCs don't fully fix that part, which they usually do, but if they don't, then mu cells would be a good idea after. But mu cells you can't use with mesenchymal stem cells because mu cells are found within mesenchymal stem cells. Mu cells were discovered in 2010 by Dr. Desawa in Japan. They stand for multi-lineage stress-enduring cells. And so the acronym doesn't fit perfect, but it sounds cool. And the reason they found these was Dr. Desawa had left some of the centrifuge portion, the first step of developing the MSCs. She had left the collagenase and the MSCs out after centrifugation all night on accident. And when they were back the next morning, they saw there were still cells alive at the top. And I said, how did those survive? Those should be dead. And when they started testing them, they use what's called flow cytometry. This can measure the phenotypes, the surface markers of the cells to tell you what they are. And they found that they actually are pluripotent stem cells. Now, what that means is that they can turn into any type of stem cell you want. And so with that, they're a true stem cell. Mesenchymal stem cells are considered multipotent. Like they can turn into certain things like cytokines, chemokines, osteophytes, osteoblasts, the building blocks of cartilage, bone, muscle, fat. That's what they can turn into. And really only in the lab. When they're in your body, they don't differentiate. So Dr. Kaplan wished he could have renamed them medicinal signaling cells because that's more of what they do. They're the manager on the construction site guiding the healing. But that's the name stuck. And that's just kind of what we're stuck with there. Mu cells are true stem cells. They can envelop damaged tissue and then differentiate into that type of cell. So it's that's what they're able to do there. It's quite different. And we are offering the mu cells now, but they're experimental in the sense that we probably could have started offering them a year ago. And theoretically, they're incredible. They can turn into any cell in the body. So they should be even better at fixing tissue damage than mesenchymal stem cells because MSCs, they'll go to the area and guide the repair process. So they can still fix a heart. They can still fix like intestinal tissue. They can fix like cartilage. The mu cells theoretically can turn into those sort of tissues and replace them with new, fresh tissue. So they should be better, but we're just rolling it out, and they've only been doing human studies for about 7 years, so there's not a lot of studies, and we're just getting data. So we've had patients coming for it now, and we're hoping they work just as advertised, but I don't want to jump too far into something before we know it works, because I've had lots of people try to sell me on new treatments and things that I thought were going to be cool and turned out not to be. Years ago, I had a guy from Arizona trying to sell me neural cells, saying they were going to fix the brain in ways never before done. And when we analyzed them, there was a few mesenchymal stem cells and nothing else. The guy was selling air. So you got to be very careful with all this. And I mean, Dr. Dasawa is amazing. She's become a good friend. I think her research is amazing, but just because it's working with some of the animals and things like that doesn't mean it's going to translate to working for all the things we think it's going to work. But we've rolled out treatments. I did them, I said, about 6 weeks ago. I don't have anything wrong anymore, though. I fixed pretty much all my aches and pains with mesenchymal stem cells, so I'm not a very good candidate. I will say I've been having some pretty intense dreams, which is similar to after I did the intrathecal treatment. So that's kind of the cool part there, is I do believe they get to the brain. Mesenchymal stem cells have trouble getting to the brain if done in an IV. Very few, if any, get there, because mesenchymal stem cells go to the heart, then the lungs. About 70% get trapped there for 2 to 3 hours, and a lot of them dissipate in. Then the rest go through. The brain's the last place they go, and they still have to pass the blood-brain barrier, and they're a little bit too large to pass. They seem to be able to kind of squeeze under, like if you imagine a mouse slipping under a door, but you don't get a lot to the brain from the IV with MSCs. Muse cells, on the other hand, the studies where they've lit them up with these radioactive dyes have shown they get to the brain extremely easy, and they don't get stuck in the lungs. So in fact, they compared it with the MSCs. We found intrathecal, where we go into the spinal cord fluid, is the best way to get them to the brain, because there's no blood-brain barrier to pass. They go right up. They did the same thing with the Muse cells, and they actually found more got to the brain via IV than with the intrathecal. So that was pretty interesting. So it's good for us, because intrathecal, though it's easy to do, it's not fun. It's intimidating, right? They're putting this needle that's like this long into your spinal cord. It can't hurt you, but mentally that's tough to believe. When you see a needle like that, you think it's going to hurt, and it's not going to be fun. I've done it twice. It doesn't hurt. And even for me, the second time was tough to do, but I did it. So that's what that is. With Muse cells, we're not going to need to do intrathecal, which I think is awesome. And it seems, the studies at least show, it helps ALS, Lou Gehrig's disease, helps Parkinson's, helps Alzheimer's. It'll help stroke and traumatic brain injury too, but ALS, Parkinson's, and Alzheimer's, I mean, the MSCs haven't done much there. So being able to treat those is huge for me. My dad died from Lou Gehrig's. His dad, my grandpa, had Parkinson's. Grandma on my mom's side had Parkinson's. So to be able to fix something like that's huge for me. Really hope it's going to work. We've got patients coming to try that. So Muse are cool. I mean, there's some really awesome stuff here. So we're looking into that. And yeah, we're excited for the Muse cells, but being optimistically cautious. Let's put it that way. That's why we waited so long to fly Dr. Dasawa here, so we could get it straight from her mouth, how they work, what they do. And now we're using her cells, putting them into practice, because she's built the lab to do all of that. So just getting those from her. The mesenchymal stem cells we do ourselves, and that's what we've been doing for like 9 years. And I think they're just going to complement each other, right? I think for more damage type issues, Muse cells, if they really work the way they're supposed to, will be where we go future-wise. But if they don't work, it's actually advantageous to us too, because then I can tell people, look, I worked with the best of the best. It didn't do what we hoped. We're only focusing on mesenchymal stem cells. So that's good for us too, because our whole lab and everything's set for that. But that won't skew what we do. We want what's best for people, not what's best or easiest for us here at the clinic. Like, that's not a big deal. We're going to still have people wanting mesenchymal stem cells either way because of how amazing they are. And look, just for autoimmune diseases alone, it's worth sticking with them. If the Muse cell tend to work better for joints and other things, great. But as of right now, there are 0 studies for Muse cells on joints. We've tried injecting a few joints, haven't seen a big improvement, but Dr. Dasawa did tell us the IV should work better for that. So yeah, there's a few different ways to go with this, and we're just going to let it play out. people are, signing up to do the Muse, and we're really excited to see how that works. We had a guy last week do the Muse cells. He's been to us for kidney failure with the mesenchymal stem cells. He got really good results, but not 100%. When you start getting to stage 3, stage 4 kidney failure, it's, you're going to be lucky to move up maybe go from like 4th to 3rd or 3rd to 2nd. It gets very tough. 1st or 2nd degree kidney failure is usually one and done. And but 3rd and 4th is more difficult. So he got, I believe, from 3rd degree to 2nd renal failure, and now he did the Muse, and he said that night after treatment, like he could feel it back here in the back, ribs in the back, right where the kidneys are. He could really feel pressure, even a little bit painful. Like he felt pretty convinced they got there. So that was exciting to hear. It's only been a week, but Muse cells do work faster. They get to the area, it's called the engraftment period, within 72 hours and get to work. Mesenchymal stem cells can take up to 2 months to really decide where they're going to focus and go in their engraftment period. So they take longer. Peak results for MSCs are usually 3 to 6 months. Muse cells, we're expecting 1 to 3 months. So should see results much faster. So that's exciting. People want now. Nobody wants to wait. Like I had to wait 5 months for my wrist to heal. That was one of the first things I did. I had hyperextended in here, and I couldn't bench press. Like I think I got lazy benching. I was like doing that, right? And hurt it. So then I got the right wrist, and we did the treatment, injected it. It took about 5 months, because you can't stop using your wrist. You're always going to use it. And yeah, right at 5 months, it was back, and I've had 0 issues since. I have corrected my form. When I bench or anything, I keep a straight wrist now, and it's been good. So that's, but it sucked waiting 5 months. The same thing with my neck. I did my neck for a herniated disc 2 years ago, and it was always sore, always hurting. I mean, I'm looking down on a computer a lot, probably heard it there. Who knows exactly what I did? I just know it was hurting. Did treatment, and again, took 5 months. Did not feel like it was getting better. It was so frustrating, but right at 5 months, it was like a light switch went off, never hurt again, and I've had 0 problems since. And I've tried to hurt it with like lots of dumb exercises, jet skis, stuff like that, and it's held up. So that's it. Question there I see is, will people be able to sign up for Muse cells? Yeah, we're already doing the Muse cells like studies, but look, they're paid studies. If you want to participate, you're going to have to pay for the treatment. That's just what it is. We're going to collect the data, but they're very tough and expensive to make. You got to think, to make Muse cells, we have to take that same whole umbilical cord, placenta, isolate it, replicate it, culture it, and then we have to kill those mesenchymal stem cells. So that's what we do. We've got these shaker tables, and we're able to control the oxygen levels. So we keep reducing the oxygen level till the MSCs die as we're shaking it, and the Muse cells survive. And then we take those, and then we start replicating those. So it's more than double the cost, more than double the time, effort, everything to produce Muse cells. Fortunately, we need far fewer of them to get the same kind of engraftment rate of MSCs. MSCs have about a 1% engraftment rate, which is why we do like 300 million in an IV, where with Muse cells, we're only doing either 20 million or 40 million. But with a higher engraftment rate, like at 15%, you'd actually be getting more to the injured areas. It's like a 300 million IV at 1%, you're getting 3 million to whatever the most problematic area is. With Muse cells, if we're using 20 million, that would be 2.5 million getting to that area. At 40 million, we're looking at I think it's around 5 million to the area. So higher engraftment means more cells there. We don't need as many. That's the good thing. Can stem cells help bone on bone knee? Yes. It depends on the MRI though. So if you're bone on any joint, meaning the cartilage is worn down, just know first off, most places start with an X-ray. An X-ray is not accurate. It's so frustrating, but if you take an X-ray, it's like a picture, right? And you're getting this solid frame. If I change the angle of how I take that picture with that X-ray, I can make anyone look bone on bone, or I can make it look like they have space. And they typically are only doing 1 or 2 photos. So X-rays only show bone, and then you're guessing as to the distance between the bones, how much cartilage there is. With an MRI, you're getting cross sections that can show tissue. Soft tissue shows up more white because it has more liquid in it, and that's what's reflecting back on the imaging so we can see. So if you're really truly bone on bone, if there's no cartilage left, we can't help. If there is even a little bit of cartilage left, which there almost always is, there's hope. Now, with the MSCs, let's say your knee's bone on bone, or they say it's like 4th degree, and we do treatment. The best case scenario I've ever seen is getting someone from 4th degree to 2nd degree arthritis. But that's a 50% increase in cartilage. I mean, it's a world of difference. It's like from going your knee locking up, barely walking, to like being able to walk and go upstairs. So it's a huge difference, and it can help tremendously. There are things that get in the way. Typically, when people are bone on bone or let it go that far, you start to develop what are called osteophytes. Now, osteophytes are new bone growth, and it's basically your body trying to stop movement. You got to think, when you're moving that knee all the time, it's rubbing. Well, the body doesn't want that to rub, so to get it to stop rubbing, it needs to stop movement, so it starts growing new bone. And think of a cave, like stalactites and stalagmites trying to reach each other. That's what the bone starts doing, and they even look like that. They're like spiky. They start going, trying to connect and fuse the joint. Stem cells cannot get rid of new bone growth. So if you've got a bunch of osteophytes, well, we're not going to be able to help. That's probably the most common reason we disqualify people. So that gets difficult. Let's see here. Benji was asking, do you see most patients experience a bit of inflammation or worse pain right over a joint or back MSC treatment before starting to see improvement? That does happen. It's a lower percentage of people. Most people, it's the most anticlimactic thing you'll ever do. You do treatment, you're like, okay, that was it. Is something going to happen? And then you're just waiting. That was like my neck. If anything, it started hurting a bit more as time went on before it just, boom, stopped. Other patients, a smaller percentage, maybe like 15%, 20%, it will be painful at the injection point. And sometimes for people, it can even for a few days be really flared up, maybe even a few weeks, because the mesenchymal stem cells send out pro-inflammatory markers. So I see this all the time with people that, like, probably the most common is someone will come in for both knees and they'll tell me that their right knee is worse than their left knee. And then we do the MRIs and we find out the left knee is actually worse than the right knee, and they're confused. Like, that doesn't make sense. It doesn't hurt. But it's my theory, at least from what I've seen, it's almost like the body gives up sometimes. It's like, hey, that knee is so bad, I don't even want to tell the brain that it's hurting. Let's just let it go till it wears out. It's not sending back the right signals. And so then we do treatment, and those are usually the people that are like complaining to me for a couple of weeks that their left knee hurts way more post-treatment than it did before, because now it's sending out the proper signals. Again, the mesenchymal stem cells have a huge immunomodulatory effect. In a case like that, the immune system wasn't telling the body that it hurt and it should be going. So now they get in there and they start communicating, and that means pain. It sucks, but that's how your body heals, is you need to listen to the pain. If something hurts, don't wait. That's your body telling you that, like, this needs to get fixed. The problem is, the older we get, the slower we heal or the worse we heal. Typically, when you get injured now at an older age, white blood cells rush to the area, and they can only heal via fibrosis. So scar tissue, they scar it up. Now you've got a problem that you can't get past. Now the growth factors and things like in your plasma of your blood, which is like when they do PRP, the plasma has all the cytokines and growth factors. It can't get past that scar tissue. Things like IGF-1, VEGF can't get past it. And so it doesn't get worse, but it doesn't get better. And then you end up getting worse because you push it too hard, because you try to, push through the pain, walk it off. Not a good idea. Things start hurting, the best thing you can do is get some stem cells in there to start healing. Let's see, Muse cells, can they help with bone on bone? We don't know. Look, at this point, there are no studies for joints and joint pain relief with Muse cells. Theoretically, they should be able to turn into cartilage, to ligaments, tendons, meniscus, but will they? We don't know. My wife had a pretty bad shoulder issue. We actually did a direct injection while Dr. Desau was here to her shoulder. She hasn't really seen a lot of relief from the Muse cells for that. But we've had quite a few patients now do the MuCell IVs that have had like some knee problems and other things, and they're reporting back that their joints are feeling better. So we do believe the IV is going to be the best way for everything with the MuCells, but we don't know. We're going to do our own kind of experiments as time goes on to try and fix some knees and shoulders and play around with that and see. But so far, it doesn't seem like direct injections are actually the way to go with MuCells. So, and then how do we direct them to make sure they go to your knee? That's where it gets tough too. Like, what if you have a bunch of other problems and we do an IV of MuCells and they go fix everything else and don't go to your knee? Like, I almost hope we have to do direct injections just like MSCs so we can target them. But as of this point, there's no research on it. And, we're taking baby steps. We're just starting with the IVs. So maybe in the future, we'll try some direct and maybe that will work. But again, if it's really bone on bone, you're still going to have some cartilage left, or the MuCells have no way. Because if you watch, I'll see if I can post the video Dr. Desawa sent me, but they tagged these MuCells for a guy. He'd had a heart attack like 5 days earlier. They gave him an IV of MuCells, and somehow they got a microscope in there and they're showing this in real time. But you actually see the MuCells go and they envelop the cell that's damaged, like they look like a macrophage, just circling it and then eating it almost. And then they start turning in to muscle-like tissue. It's incredible. So that's what they're able to do. But again, if there's no cartilage, then they don't know what to do, because they have to eat the bad cell to turn into it. It's like they somehow gather its data and then transform into it. So if there's no cartilage, there's no way to fix it, even with MuCells. But there's almost always some there. So should work, but we don't know yet. COPD, yes, we have protocols for COPD. COPD is chronic obstructive pulmonary disease. Basically, you start getting older, you see the older people that need oxygen. That's typically COPD, emphysema, like pulmonary fibrosis. It's kind of a catch-all term for a lot of these lung type issues as we age. And for that, we typically do the IV, about 200 or 300 million, because again, that goes heart then lungs, and they'll stick there for 2 to 3 hours. If you got a lot of damage in the lungs, they're going to dissipate in and work that way. But then we also do what's called nebulized, where you're breathing in the cells. You put this mask on and it nebulizes them, and you're just breathing it in, and that gets deep into the lungs. I actually had this cough like a few weeks ago that was just, I could not get rid of it. I'm pretty sure now there's some mold in my house, not 100%. I had a similar cough like before COVID happened back there in 2019. I think I was one of the super spreaders. It was a bad cough just before that all blew up. And it was the same sort of cough, just could not get rid of it for like 2.5 weeks, just wouldn't go away. And I finally am like, hey, I've got stem cells. Why am I not using the stem cells? And I nebulized some stem cells. Next day, cough was gone. And with COPD, it's not usually that quick, because typically a lot of it's from smokers. They actually heal the best. I've had long time, like lifelong smokers, that cleared up their COPD the fastest, because that's mostly scar tissue. And stem cells love scar tissue, because that means inflammation, and they know exactly what to do to get rid of it. So they work extremely well in those cases. It's the patients that have COPD that don't know why that typically don't get the best results. And look, if we couldn't diagnose it before coming, then it's kind of a guess at that time anyways. I mean, we're not a diagnostic center. We do a lot of diagnostic. I mean, we do really in-depth blood panels. We have our own MRI machine. We do MRIs. We do, can do chest CTs or X-rays, and we do all that when we have COPD patients, but it doesn't necessarily tell you what caused it or why you have it, right? So it's the few times, we've had patients that didn't really respond is usually because we don't really know what caused it in the first place. And, maybe it was genetic. We can't change genetics. That's the tough part with mesenchymal stem cells. But if it's being caused by chronic inflammation, if it's being caused by damage, if it's being caused by autoimmune issues, that's where these things really excel. And that's most issues. I mean, just about every disease starts with inflammation, right? So the big benefit of mesenchymal stem cells is they target inflammation and start fixing the underlying cause. Muse cells do the same thing. So really looking forward to the Muse cells. Hope those work. Hope that we continue with both of these, but we're going to be straight with the Muse cells, whether they work or not, with people, and let people know. And if we don't see much from them, we'll probably stop doing them in a year. But if they do, we're going to just keep going with it. It'd be good. Benji's saying, come down for the 300 million. Yeah, I agree. I mean, well, I do it, but I'm lucky. I've got all the stem cells I could ever want. But yeah, I do. I've probably done more stem cells than anyone out there, right? At least twice a year, I do an IV, usually one on purpose, usually 1 or 2 per year because a patient can't do them, something happens. And, we won't do treatment if we find a reason not to. It's not fun. It costs us a lot of money to have cells that we have to just absorb that cost. So if I got to absorb the costs, I'm not going to waste them. I'm going to use them. So I've had, patients where we found out they had cancer. It sucks, but, that's going to be more important than doing stem cells. We don't treat anyone that has cancer or has had it within the past 5 years. And we really don't even think that cancer is really not even a scare or we're worried about. It's just there's no real data on it. And the problem is there are clinics, especially in Mexico, trying to offer mesenchymal stem cells for cancer. And I just think that's wrong. So we just distance ourselves as far as possible from cancer. I do know a guy, Dr. Jason Williams. I mean, this guy is like the top cancer guy out there. If you ever know anyone with cancer, cannot recommend him highly enough. It's williamscancerinstitute.com. He uses specialized immunotherapies, and I mean, he is curing cancer left and right if it's tumor-based. He does it up in Cabo. He's in phase 2 trials with the FDA because the medicine he uses mainly is actually already FDA approved just for some really rare types of cancer. It's how Jimmy Carter, ex-president, survived, like terminal brain cancer was with the same medicine. And just because they gave him special access that most people couldn't get. So Dr. Williams injects this stuff into tumors, sees them goes away. It's incredible. Someone asked about price list. All of our prices are on the website. If you go to www.dreambody.clinic, scroll down on the homepage, you'll see all the treatments listed. Just click info, prices are all there. And they're all set. We keep them as low as we can to help as many people as possible. So if you want multiple things, you can totally do multiple treatments. Like if you want to do both knees, both shoulders, intrathecal, IV. Look, the cells stay in the area injected, so you can do all those. It's great. The Muse cells, those are listed at dbcmusecells.com. Treatments are listed there with prices and all that. I do not do question. Do you ever see Muse cells coming to the US? And why are there so many more restrictions? Muse cells and mesenchymal stem cells cultivated like we do will probably, well, I know for Florida, like, is it DeSantis, the governor there? He's agreed to look the other way. So they will start allowing them there, but they have to come from a GMP and ISO rated lab like what we have. And the problem there is you're going to have to fly them. Now they got to go through x-rays, which is going to kill or damage a lot of cells, and they're going to have to freeze them. So they're not going to be as good right there. And if you're going to be doing it in places like Orlando or Miami, they're going to jack the prices up insanely high. So I think we're always going to have the price advantage, even if they become legal there, but they're not going to. Here's the problem with the way the FDA works is that I knew a lab up in Boise that did the frozen umbilical cord cells, stem cells. They were just trying to copy the Utah Cord Labs model, which is an established lab that's been doing this for well over a decade with frozen umbilical cord cells. And again, they're decent. You can get maybe like 10 to 20 million cells there, but you're probably going to lose half of them in the freezing thawing process or more. So they're less than ideal, but better than nothing. And these guys in Boise just wanted to copy that. But once they got their lab ISO rated, GMP, all the stuff the FDA looks for, and then the FDA came in and said, no, that's a new medicine. You need to apply for a new medicine application. $2.5 million just to apply. And all that does, if you get approved, is allow you to get into all 4 phase trials of the FDA. So now you only get to pick one thing. You don't get to, if you look at my website, there's like 70 treatments listed. You only get to pick one. So let's say cartilage in the knee, because knee arthritis is the most common thing we treat. Let's do that. Well, now you're going to spend anywhere from 40 million to $1 billion and spend about 10 years getting through all 4 phase trials, if you get through all 4, because they can deny you for, I mean, the list of reasons why they can deny you is infinite. And look, big pharma doesn't want that because it'll compete with what they're already offering. And if you got it approved, at the end of the day, you can't patent something natural like a mesenchymal stem cell. So all you would do is open the market to your competition. You'd be out hundreds of millions of dollars and you'd never get your money back. So unless you're just like the biggest philanthropist ever out there, it's just not going to happen. In fact, one of the co-founders of Home Depot was funding studies at Duke University for autism with mesenchymal stem cells, and they shut that down because they didn't like that it was helping a lot of these kids, and that just kind of went against the status quo. So I don't see it coming to the United States the way we can do it anytime soon. It sucks, but that's the reality of it. Well, there we go. Look at, we got patient there, came for knees. Well, thank you for coming, and you keep us updated. We want to know how that goes, and yeah, we do our best to keep prices as low as possible. There's a lot of these other clinics out there that just use all these celebrities. We get celebrities, but like I never ask them to promote for us, because first off, like you're just going to get their fans blowing up your phones, and we're busy enough. I barely have time to make videos like this. And second is, that can work for you against you too. I mean, if one of those, you piss off one of those guys, they got a big reach too that could really hurt you and hurt a lot of people that could benefit from this. So I just don't see the reason to do that, because they're giving those people free treatments for the promo, and those are the people that don't even need it for free. They can afford it. So it's I don't know. I don't like that. We like today I filmed with a patient. He was happy to do it because we've helped him. This guy's had pneumonia for like years, kind of COPD like issues, and he's doing way better. So he came back again. We did more cells, did some other things, and he's super happy. We always hope it's one and done, but some cases, if it's really extreme, it needs more than one treatment. And we just try to be honest with all that, give people honest assessments. If we can't help, we're going to tell you. And we get some people that have osteophytes and they don't care. They're like, let's just try it. Well, we're willing to do that too. If you're saying, hey, we don't think this will help much, but you still want to try, we're willing to do that too. But if we don't think it's going to help, we tell people, and we just want to be as transparent as possible. So that's what it is. How many U.S. physicians here are waking up to the benefits of MSCs and are frustrated with American healthcare? I think a lot. I mean, I've had American doctors coming to me for 9 years now. I mean, not all of them, but you can see I've got a really good testimonial from one of the top neurosurgeons from New Jersey. He's had ulcerative colitis like all his life, and nothing's worked. And he was just back here for a round 2 when we got him. He said he's like 70-80% better than he was. And so he came and did it again. He's super happy. And I mean, it's just crazy. This guy, he's a neurosurgeon. I mean, like, you can't get more trustworthy or better than that. The guy works on brains. And he trusted us. I've had one of the top internists up in the Seattle area where I'm from has been coming to us for like 9 years for all kinds of stuff. He was probably the most skeptical to go in and do his knees, but we fixed his knees. And I think doctors, it goes back and forth. I mean, and then, you get other things. I had a patient who's planning to come message me yesterday that he wants to bring his mom, his kind of early stage Alzheimer's, and his local doctor is telling him, oh, it's a waste of time, money, there's nothing. I specialized in stem cells in my at school, and there's nothing yet. But I don't think he'd really heard about the Muse cells, which with mesenchymal stem cells, I agree. So the problem is continued education. Tony Robbins wrote a really good book called Life Force. And that's one of the things he points out in it. It's by the time a doctor even graduates med school, it's like 80% of what they learned is obsolete. I mean, there's so much new stuff coming out that no one could keep up with it all. And people kind of stick in their rut, stick with what they're doing and with what works. And that holds things back. So it's tough to say. I mean, there's so many doctors out there that have never even heard of stem cells. So it's it just depends on the person, you know. And a lot of them say, hey, go try it out and tell me how it works. So others will tell you it's, you know, we have a great testimonial from a guy who is basically, they gave a 3% chance to live with this rare heart issue in the UK. And we fixed him 5 years ago. He was supposed to die within months of that, and he's still alive. That was back in 2019. And a great testimonial with the guy. He's from, I believe, Newcastle. And he said when he went back to his doctors in England, they literally told him, we don't talk about witchcraft here. No, we can't talk about that stem cell witchcraft. You're like, are you serious? Like, you told this guy he's going to die, and now he's not, and yet you still can't acknowledge it. So you get everything in between. It's crazy. But yeah, well, thanks, guys. I got to get home. I got to go check on my son, do all that. But I'll do more of these live ones. Thank you, all you who commented here. And you all know, you can call me anytime, message me. Look, I take all the calls, all the messages. It's just me. I've tried having friends help and employees, and it just never works out. They don't seem to care, and I do care. So I want to help you out. You can check out the website at www.dreambody.clinic. You can call toll free at 888-704-3977. Happy to talk with you. Happy Thanksgiving. I forgot it was even Thanksgiving. So even bigger thanks for watching, because awesome. Yeah, we're always thankful here in Mexico. So we don't have a special day for that, but glad everyone there is doing so good. Do you sometimes give person more than 20 million Muse cells at DBC? Yes. The 20 million is just we're calling it the anti-aging protocol. That's kind of the catch-all, just so we can collect some data. We're asking people to do the DNA methylation test before and after. We do 20 million there. But look, Dr. Dasawa told us every study in Japan has only used 15 million. So even going 20 is a bit higher. But we decided we're doing 40 million for organs. So for the brain, for the heart, for the pancreas, for the liver, for the kidneys, we're using 40 million. And I don't know, it's just, we don't want people to come all the way down here, spend that kind of money, and then find out it wasn't enough. So I'd rather you do too much, and you have the option. If you've got like kidney issues and you just want to do the 20, cool, just sign up for the anti-aging protocol. We're still going to check all the same blood markers, so we'll have that data. But those are the only options right now. I don't feel comfortable going any higher than that. I know one group that's gone up to 100 million, but Dr. Dasawa really doesn't think we need to go that high. So we're going to start with this and then kind of adjust as it goes. That's awesome. Susan paid for some umbilical placenta stem cells 7 years ago. Best money ever spent. That's awesome. Well, thanks, guys. Thanks, everyone out there. I got to get going here. Let's see. Would you still recommend MSC effectiveness for brain injury adults, even with the Muse cells? Yeah, for sure. Like the Muse cells, I feel get to the brain just from me doing them and what I've experienced with it. But we also have the MSCs, the intrathecal. I mean, they're totally different ways of acting on the brain, but they both help. Like I had never not remembered dreams since I was a little kid before I did the intrathecal with the mesenchymal stem cells. And right after I started having crazy dreams, started like just recalling things faster. Like I do a lot of two-factor authentication where you got to memorize those like 6 or 8 digit numbers for codes for like crypto and stuff like Bitcoin and all that. And it started getting easier to remember numbers. So I felt more clear, I guess. I mean, I never had real brain fog, but just felt like my recall got a bit quicker and snappier once I did that. And with the Muse cells, I'm not so sure because look, the second time I did MSCs, I didn't feel as profound an effect as the first time because I think I fixed a lot of the damage from when I was younger. I mean, I played every sport growing up, had concussions. I drank way too hard on the weekends from like 15 till 30. So definitely caused some damage there. And I think it fixed a lot of that. So at this point, I don't have a lot of stuff wrong with me. So any little thing I notice, I'm like, hey, I'm having dreams again, like kind of crazy, like I did after the intrathecal. That makes me think the Muse got there because it started right after I did that. So I'm just noticing the little things, but we've got quite a few patients coming for brain type issues between Alzheimer's, stroke, Parkinson's, and all that signed up for the Muse. So we'll have data. We'll keep publishing it, let people know. I've been running elamepetride 5 milligrams on some other stuff to protect the MSCs from ischemic shock, as well as NAD and glutathione, starting Cardillacs 2 weeks once they're settled. Awesome. That's great, man. I don't know a lot about elamepetride. You'll have to tell me about that later. Shoot me a message and I'll do some research. But great, man. I mean, peptides work great with stem cells. You got to think mesenchymal stem cells are like, SS31. I haven't looked deep into that one. I've heard of it, so that's interesting. I'll do some research there. But yeah, peptides, think of the mesenchymal stem cells like the manager construction site. Peptides are like the workers. So you got more workers, you're going to heal faster, get better results. Like I've personally been on human growth hormone now for 13 years. I mean, like, unless I can't afford it, I'll be on this the rest of my life. I love this stuff. And that converts to IGF-1 in the liver. IGF-1 is one of the main growth factors in your bloodstream and the plasma. It just helps you heal faster. So that's why I love growth hormone. But growth hormone, it is expensive. It's like the icing on the cake, though. I mean, TRT or hormone replacement therapy for men or women is like the low-hanging fruit. I think just about everybody should be on it. It's so beneficial. And growth hormone just takes it to the next level. Muscle retention, fat loss. You notice that. This is the weekly growth hormone, not the daily. This is the daily, and I love the weekly. So this is the one I've been using. It's been almost a year now that I've been taking this one, the Ngenla. This one you inject daily, little teeny tiny insulin needle you inject, and it's been great. I would do 0.6 milligrams, which is 1.8 IU of it. But you got to understand, I was 180 pounds when I started all this. I'm like 245 pounds now, and it is weight dependent. So I did move this up to 0.9. And that would keep me between the 300 to 400 range of IGF-1. I do 15 milligrams of this one a week, and just once a week. And this has been hitting me over 500 on IGF-1, which it's almost too high. In fact, I've kind of lowered it down to 12 milligrams, just because if you stay too high too long, you can start issues with acromegalia, like, your bones start growing too much and all that. At lower doses, that doesn't happen. Even at that dose, this one, it'd probably have to be on it for like a decade for that to really happen. But either way, you don't want to push it too hard. I mean, I'm not a bodybuilder. I'm not trying to, get on stage, play any pro sports. I'm in it for the longevity benefits. I love the fat loss benefits too. The muscle retention's great. This has been the worst year of my life working out. I am lucky if I get to the gym like twice a week. Just been working, a lot of stuff going on. And I have not lost any muscle. I'm not fat, not like in the best shape ever, but I have like very, very little fat. And my diet has not been on point. It's kept me really skinny, and I love that. And it's kept the muscles. So I'm hoping here for the next year, I'm really going to dial it in on the working out, really focus on that. I mean, you can't call it Dream Body Clinic and not have the dream body, right? So I'm going to get that back on dial, and this will be a big part of it. This is working real well. I want to put it to the test now. So we'll put 2025 down as just, we're getting everything dialed in, got the lab dialed in, all that. It was a lot of work, but now that's all done, I can really focus on me, and that's what I'll do. With booking for appointments, immediate or can it take a while? Oh yeah, so bookings, we treat a lot of people. We're averaging around like 100 people a month right now, and it's full, but it's not completely packed. Like there's always spaces. So, I mean, if you told me you wanted to come next week, I mean, between now and Christmas is tough, but there's still space. So you just call me up and let me know your ideal dates. And we can usually make it happen. Yeah, look, like Diego there got them within 3 days. We can. Every week there's spaces. So it's, we're not so beyond packed we can't fit another person, but we're pretty well booked up through January. Like if no one else signed up all the way to like February, I'd be fine. Let's put it that way. But there's space. So you just call us, let us know your ideal dates, and we take it from there. Have you seen any confiscation of HGH from U.S. Borders Customs? Nope. I've never had growth hormone confiscated ever. We've been doing this for like 13 years. I've had some of the top federal judges in DC. I've had one of my recurring patients used to like be the top guy at TRICARE. I mean, some have had Congress people come. I mean, some pretty people that would not risk this if it wasn't legit and couldn't do it. So no, we've never had an issue. We've had some people, maybe like, I don't know, probably around like 12 or 13 over the years that like TSA will give them a hard time because of the gel ice packs. So what I found is if you just put it in your check-in, never had a question with check-in. But we provide all the documentation. So as long as you just say, hey, if they ask you what it is, you just say, look, it's my medicine. You're not my doctor. I don't have to answer this. Like, it's like, a doctor's like your lawyer. They can't release confidential info. And Customs never has had a problem with anything. The few times there's been issues, it's been TSA. I guess there's been a couple of people who've had to go to the back room for TS or Customs, but no, we provide the documentation, everything. So we've never had a confiscation of that. We had one guy that they took like some of his testosterone. So one guy in 13 years, and he could have fought it, but he had like 2 duffel bags of steroids, I think a duffel bag full of growth hormone. It's like in his 60s, an ex-NASA engineer. And I mean, he did not look like the guy going back with all that stuff. And some cowboy in Dallas, one of the Customs guys, I think knew what the test was. And he took 20 of the 50 tests. But in 13 years, that's the only thing. And it's really because the guy didn't push back. He's just like, yeah, take it, leave me alone. That was it. So real simple. It works. We back it up. And check it out. www.dreambody.clinic. Thanks, guys. I got to go. Bye.